Welcome to our channel, where we share information on reproductive and sexual health. I'm a Muslim physician living in Turkey and a specialist in obstetrics and gynecology. I have 30 years of professional experience. I've examined countless women, delivered thousands of babies, and performed numerous surgeries. For the past 17 years, I've been working in the field of reproductive and sexual health, conducting research and attending trainings. Today, I'd like to talk to you about this. How is sexual health education progressing in Turkey? And how is it structured in the countries where you live? Especially for professionals like doctors, mental health specialists, family counselors, faith-based guides, and teachers. In short, anyone who works with youth and families. What kind of sexual education have they received? Are they receiving or are they providing? I'm genuinely curious about the answers to these questions, and I'd love to hear your suggestions and insights. In my country, in the region where I live, sexual health education in medical schools mostly focuses on the anatomy, neural function, and physiology of the reproductive organs. Sexual dysfunctions are generally addressed during our psychiatry rotations and lectures. Later, during my 5-year residency in obstetrics and gynecology, sexual dysfunctions were still mostly seen as a psychiatric issue. After completing my specialization, which took place between 1995 and 2000, and especially after 2000 when I started working directly with patients, I noticed something even during my residency. In outpatient clinics and crowded hospital settings, women felt they had no choice but to whisper their sexual concerns to me. But I couldn't find the time to listen properly. Their problems remained unresolved. Later on, whether in my private clinic, in private hospitals, or in rural areas where I was assigned for public service, I kept seeing the same thing. People were seeking help for sexual problems, but couldn't find real solutions. As doctors, we lacked both the time and the proper knowledge. We couldn't give them the attention they needed, and when we did listen, we often didn't know what kind of treatment to offer. As I kept thinking about this, I felt a sense of professional responsibility and said to myself, I have to do something. What can I do? I need training. Where can I get sexual health education? I realized that in my country, such training was mostly offered by private associations. So, I attended programs led by 5 different instructors from 5 different organizations, covering both female sexual health and male sexual health, or andrology. There were sexology departments abroad, in countries like Canada, the United States, and some European nations. Physicians from these departments came to our country. We held a joint congress with them. This was incredibly beneficial for me and for the participating doctors as well, especially because they were very curious about my identity as a veiled woman and about sexual life in Islam. During discussions with foreign colleagues, a common belief caught my attention. It was thought that Muslims have difficulty accessing information about sexuality, avoid talking about it, and are not part of a systematic education process. It seemed like a backwardness label was constantly imposed on us. They were not entirely wrong, because until I attended that 2019 Congress, I had spent 11 years training myself from 2008 to 2019. I had taken courses from 5 different associations. In the field of genital reconstructive surgery, I treated many patients with anorgasmia using orgasm injections, G-shots, or helped women struggling with low self-confidence, who disliked their own labia, saw their sexuality as insufficient, avoided looking at themselves in the mirror, or preferred to be with their partner only in the dark. This was often due to a combination of poor body image and lack of education. Many women felt incomplete and struggled to express themselves as women. My work in genital reconstruction has been extremely beneficial in these cases. Additionally, between 2012 and 2019, I worked with young people for 7 years. I participated in anti-pornography groups, reviewing their communications and efforts. I studied treatments for pornography addiction abroad, read numerous articles, and invested a lot of effort to compile an encyclopedia on the subject. At the conference, I discussed the harmful effects of pornography on youth, how it can ruin their futures, and how many start to become curious and addicted to sexuality at a very young age without even realizing it. This deeply concerned me, and I addressed this topic there as well. Additionally, in cases of anorgasmia, we explain the situations in which we intervene with genital reconstructive surgeries and the procedures we perform. We clarify our stance against female genital mutilation practices and the objections we have raised regarding this issue. We share the treatment options that we, as physicians, can offer against practices such as the complete removal of the clitoris, cutting of the labia, or restriction of sexual pleasure. We also evaluate the success rates of our surgeries within this context. We have conducted numerous presentations and joint meetings on these topics. In the field of sexual health, the specialization of physicians and psychologists generally depends on their individual efforts. They attend various trainings and congresses. Afterwards, they compare this knowledge with foreign literature and approaches from sexology departments, developing their own clinical experience-based practices. These efforts can take the form of workshops, seminars, and both online and in-person trainings. Based on our own experiences, we have organized various training programs, especially for physicians and mental health professionals. In these programs, we focus on topics such as premature ejaculation, erectile dysfunction, vaginismus, dyspareunia, paraphilias, and sexual desire disorders. We also run projects addressing the causes and solutions of anorgasmia, which is quite common in our society. I want to emphasize the importance of sexual education provided before marriage. How should parents communicate with their children during adolescence? How should they teach them about these issues? And at the same time, what kind of protective approach should they adopt? Also, how will spiritual guides, who know Islamic jurisprudence and try to teach young people about puberty and religious duties, integrate this with sexual health? Yes, unfortunately, there are many shortcomings in this area, and we are constantly working to reduce these gaps. My 30 years of medical experience, 6 years of medical school education, and 17 years of work in reproductive and sexual health compelled us to establish an association. Why compelled? Because we needed to create something beneficial for humanity. We wanted to carry out beneficial work in the area of sexual and reproductive health, which has been so neglected. Thus, together with our colleagues, psychologists, and legal experts, we established an association. We opened an academy, created a website, and activated our social media accounts. Of course, we have gaps, and we are working to fill them. We are developing our projects and educational materials. So far, we have prepared 6 encyclopedias and 3 textbooks. 4 of these are a series of books aimed at parents and educators to teach sexual health in the best way possible. Additionally, we have an encyclopedia on combating and preventing pornography, 1 on female orgasm, and 3 books addressing preparation for marriage. These books are essential reading for every young woman and man before marriage. Yes, these are among the many projects we strive to contribute to humanity. I would be very glad if you could share information about the education systems, sexology departments, and initiatives in your own countries. What are the initiatives that are particularly beneficial to humanity? As physicians, are you able to present and explain sexuality free from perversions and pornography? What books or works do you have? If you share your comments, I believe I can conduct much better educational programs both in my own country and in yours in the future. The possibility of having our books translated into the languages of your countries excites me greatly. That's why your comments and contributions are truly valuable to me. It would mean a lot to me if you share our channel with your colleagues, help promote it, and send us your contact information. Wherever you live, I wish you a life full of health, happiness, and joy. I send you my deepest love and respect. Take care.